and made me realize that I could turn the pain that I was feeling from my grandpa's loss into purpose to potentially help other people.
This is More to the Story, a podcast of Thomas More University. We highlight the people of Thomas More, their experiences, aspirations, and how passion meets purpose and drives possibility forward. Join us as we foster conversation and connection, because we know there's always more to the story.
Welcome to More to the Story. I'm your host, Michael Weller. This is episode 1 of 4, where we're focusing on mental health awareness. In alignment with Thomas More University's mission to examine the ultimate meaning of life and our responsibility to others, mental health awareness is a vital part of that calling, inviting us to support one another, uphold dignity, and build a community rooted in empathy and service. In this series, we introduce you to 4 individuals from the Thomas More community who are leading, supporting, and advocating for mental well-being. Through their stories and experiences, we'll highlight the ways our community is working to build awareness, strengthen resources, and ensure that every person feels seen and supported. So let's get to today's guest, Thomas More student, Lucabella LaEace. Lucabella is a senior nursing student here at Thomas More, where she serves as Secretary of the Student Nurses Association. A suicide loss survivor turned mental health advocate, Lucabella is the founder of the 501c3 nonprofit Let's Talk, Let's Listen, an organization dedicated to ending the silence surrounding suicide and empowering young people to seek help. She also serves as a local ambassador within the Miss America opportunity as Miss Clayland and will compete for Miss Ohio 2026 in June. Lucabella is passionate about combining healthcare, advocacy, and service to making a lasting impact in her community. Welcome, Lucabella.
Hi, thank you for having me. I'm so excited.
Yeah, absolutely. Well, so this is, obviously, as I just said, the first of our episodes surrounding mental health, so super excited you're here. But let's get right into your story here. So you're a suicide loss survivor and now an advocate. What was the turning point when you realized you really wanted to transform that experience into something actionable?
Absolutely. I think every suicide loss survivor has a story that needs to be shared. And it's just about the time and whether or not they feel comfortable sharing it. I lost my grandpa to suicide when I was just 10 years old, and my family struggled with it for a long time. And I didn't find out the true cause of his death until I was 13. I was 10 years old, too young to understand the concept of suicide and what that could mean and why somebody would want to take their own life. So my parents didn't tell my 2 brothers and I how he had died for over 3 years. And I think both of my parents were kind of stirring around the fact that they wanted to do something about it. They wanted to advocate for mental health awareness and suicide prevention, and they wanted us to be a part of it as well. So they eventually told us, and it caused me to have mental health spirals for a long time, really struggling with why my family was not enough for him to want to stay on earth and to want to live. And my family noticed this, and they found the Youth Council for Suicide Prevention through the 1 in 5 organization, which is a mental health organization in Cincinnati. Their mission is to stop the stigma and start the conversation surrounding mental health. So I joined this Youth Council for Suicide Prevention kind of begrudgingly at first. And then I got into these meetings, and it was other young people who were suicide loss survivors or were living with anxiety or depression or OCD or any other mental illness. And we were able to just connect. It was kind of like a disguised group therapy situation, or at least that's how it worked for me, and made me realize that I could turn the pain that I was feeling from my grandpa's loss into purpose to potentially help other people. So that's when I started volunteering with the National Alliance on Mental Illness through their walks, and now being a weekly presenter through their Ending the Silence programs. Just Monday, I was at a high school in Cincinnati talking about this program and where to find help, what the warning signs of suicide are, and how to support and be a good friend to our peers who may be struggling. And then I also decided to start my own nonprofit organization.
That's awesome. Wow. It's really inspirational.
Thank you.
Honestly. Perfect. You just brought us to our next point. The Let's Talk, Let's Listen to end silence around suicide, your nonprofit. Tell us more about this organization and what was kind of missing in those conversations around mental health that made you say, this is something that needs to happen.
Definitely. I am a nursing student here at Thomas More and have had so many clinical experiences. And I specifically remember being in one of my classes, and one of my professors said that on average, healthcare providers interrupt their patients when they're telling their stories within 11 seconds. And that just baffled me, right? It's crazy to think because, and then another statistic was that it takes about 46 seconds to a minute to really share the story and all the symptoms that they're feeling. And that made me realize that not only do we need to talk about mental health and suicide, but we need to listen to people who are willing to share. So it made me realize that there is still so much stigma surrounding mental health and suicide. Also in the healthcare space, we were supposed to be advocates for our patients, but if we don't know what they're experiencing, how do we advocate for them? So I want to work as a future nurse in the near coming years to be on different committees or to create initiatives in the hospitals that I'm working at, as well as other hospitals as well, to have more conversations around mental health. We do a lot of our clinicals at St. Elizabeth, and they have great initiatives to really support their staff. I did the SNAP program over the summer, and they offer great EAP programs to cover therapy for their staff members, which is great because you see so much as a healthcare provider. And with all of that, they have, calm corners and different things. And then over the summer last year, I was able to be awarded with the Cincy Serves Award for the Cincinnati Open, sponsored by Fifth Third Bank. So I got a $5,300 donation for my nonprofit. And another one of the initiatives that I want to make with that is specifically for young people. And I published a children's book in May of 2022 called More Than Sad, featuring Cupcake and Star. It's a children's reading book as well as an activity workbook and coloring, because that's great for kids' mental health. But it goes through the story of Cupcake and Star, two friends who realize they're feeling more than sad and find an adult to talk to reach out for help. And I'm hoping to use this money to donate over 2,500 books to the children in the Northern Kentucky and Cincinnati area public schools.
That's awesome. That's awesome.
Thank you.
All right. So switching gears a little bit, I want to do a little segment here about your experience here at Thomas More. So we know what the mission calls us, to examine our responsibility to others. How has your experience here shaped the way you approach healthcare, leadership, and your mental health advocacy?
It's been absolutely empowering. I love the small community that I've been able to build here at Thomas More. My nursing cohort is about 16 people, I think, and it's been great. We started my freshman year with over 60 people and have just been cutting it down and down as we go through the years, but the relationships that I've been able to form with my professors are so special because of the small environment that we have. I also think something special about our nursing department is that all of my professors are required to still be working in the hospital. Sometimes in other schools, you might have it where the professor never worked as a nurse, or they haven't in years and they don't know how things really are in the world right now. The fact that they're actively working gives us relevant information that prepares us for our jobs after graduation, as well as our clinical hours, but they have empowered us to go into the hospitals after we graduate and be ready to take a leadership role. They know the prestigious program that we're in is recognized by the hospitals in this area, and they have been preparing us. The classes I'm about to take are about management as a nurse, and I'm like, hold on, I'm literally still studying to pass my NCLEX, but they already believe and know that we have the skills because of the program that we built here to be a charge nurse, to be the person that is doing schedules as well as working on committees like I was talking about. They know that we want more and more and that we're going to continue to achieve that. So I'm very grateful for all of my professors and the friendships that I've built through this program. Over spring break this year, I'm able to go to Texas with the nursing program with Sister K, and it's completely sponsored by Thomas More alumni. They are sending us to Texas to go to Holy Family, which is a birthing center for underprivileged women. And I know it's going to be a life-changing experience that I'm really looking forward to. I'm just grateful for Thomas More for that opportunity.
That's great. Yeah. As a student myself, I'm in certainly a different field. I'm in business school. So, but we've had a lot of people on here that I wouldn't have gotten to, interact with previously. And honestly, it's the biggest compliment to me that to know about all these great things happening here at Thomas More. It's like, I'm sure you feel this way, but it's like, that's the school I go to.
Absolutely. We're small but mighty. I work at a restaurant, and just a couple days ago, I saw someone with a Thomas More hat on, and I was like, you, coach? And he's like, oh, you student? Like, he left me a huge tip. He's like, he wrote roll scenes on the credit card check. I'm like, it's a small community, but we find each other everywhere.
For sure. Yes. Yeah. It's awesome. All right. So staying in the community here, I want to talk about students here. If somebody feels passionate about mental health or really any cause, but don't really know where to start, not necessarily here on campus specifically, but just anywhere, what advice would you give to them about getting involved and using their voice?
I would say to find a local organization that might be partnered with something that they're passionate about. For me, that was mental health and suicide prevention, and that's why I found the American Foundation for Suicide Prevention or the National Alliance on Mental Illness. I would find a local organization that is aligned with something that they're interested in. They're not just going to throw you on a stage and say like, okay, go tell everyone why you're here. Go share your story. They're going to maybe take you in as a volunteer. You can go take classes and learn more about what you're interested in. And then if you feel called, you can take more of the role of sharing your story. It took me a while to get to this point to where I feel so comfortable talking about it. But I think that's what's so important, is that finding something that you're interested in, especially as a young person, and getting involved in it. When I worked with the American Foundation for Suicide Prevention, it's a lot of older adults, and they're excited to have young people involved. We might think that they don't care what we have to say, but I actually was able to be the youth representative when we talked to our legislators because they wanted a young voice. They wanted someone to speak for our generation, what we're needing. So I would say to take some baby steps and get involved in something where you don't have to do all the organizing. You just have to show up and maybe meet people who are passionate like you.
That's awesome. All right. So looking forward into the future, right? Between your nursing, nonprofit, competing for Miss Ohio, and using all the platforms you're a part of to advocate, how do you see all those pieces coming together in your future career? I know you already touched on it a little bit, but just a little more into that.
Mm-hmm. I'm very excited to graduate in May and hopefully work as a registered nurse in one of our Cincinnati or Northern Kentucky hospitals. On the job search right now, but hoping to use everything that I've learned and culminate as, a representative from Thomas More, being a charge nurse or being on a committee that's talking about mental health as well as just wellness in general. But I think something else that's really important is understanding that everything that I've done with mental health in my past is going to help me and all of my patients in the future. Sometimes it's these big moments like the winning grants or, being on and having conversations like this for other people to hear. But there's so many little moments that are important as well, even more so. The conversations that I have with my patients where I might recognize that they're struggling mentally because of the time that I have working in the mental health space. I can help them get the care that they need, or something that I've put in place helps someone else get the care that they need. I am excited to see how those small moments really impact others in the future.
Well, that's great. Once again, really appreciate you coming on, sharing your story. It's honestly amazing.
Thank you.
This is really cool that somebody within our Thomas More community is making such a big impact, as we tend to do, as we talked about. But as we wrap up, is there anything else that you didn't mention that you might want to add?
I'm excited and grateful to be on here today. You kind of asked, but I encourage anyone who's passionate about something to just take the leap and get involved, because you never know how fulfilling it can be for yourself. We see people say that they were impacted by or a big organization, but it's so impactful on the person doing the volunteering as well. And you never realize how therapeutic it could be. For myself, it has healed so much in me to talk about my grandpa's loss. It still is heartbreaking, right? I'm never going to be 100% over losing him, but every time that I get to talk about it, it makes it feel like it was for something. And I know that that's what he would have wanted. And we all have something like that within ourselves. It's just having the courage to talk about it. And I encourage everyone else to maybe find what it is in themselves and reach out and get involved.
Awesome. Well, thanks again for coming on. Appreciate it.
Thank you.
If you or someone you know is struggling, call or text 988 to reach the Suicide and Crisis Lifeline, or visit 988lifeline.org. That's 988lifeline.org for confidential support. If you're part of the Thomas More community, campus counseling services are available to support you. Please check the episode description for information on how to get connected. That's it for today's episode. Please follow along as we look for what's more to the story. You can find us on Spotify and on YouTube. This episode was produced by Kendra Yurt and the marketing and communications team at Thomas More University. Artwork and editing by Kendra Yurt.